Chapter 14, Sequencing Curriculum Content and the Spiral Curriculum. Sequencing curriculum content can prove complex. Some approaches to help the learner achieve the expected learning outcomes may be more effective than others. The importance of sequencing. In planning a curriculum, much attention is paid to the different elements, including the learning outcomes, the content covered, the teaching and learning methods, educational strategies, and assessment. It is just as important to consider the bigger picture of the curriculum and which courses are included and how they are sequenced. Sequencing of courses in the curriculum involves the arrangement of courses in a specific order. The order of courses can help students to organize meaningful patterns in the vast amount of content. By doing so, they are less likely to forget what they have learned and are able to apply knowledge to new problems or unfamiliar contexts. For example, the earlier introduction of clinical experiences in the curriculum provides students with a context for learning the basic sciences. The sequence of courses, however, may be dictated by the fact that prerequisites for a course may include the learning outcomes achieved in an earlier course. Establishing connectivity and interdependence of the courses. Students should be assisted in identifying connections between courses in terms of what they are currently learning, what they have previously learned, and what they have still to learn. This should be made explicit in a curriculum map as described in Chapter 22, Guidelines for Sequencing. Of prime consideration in the sequencing of courses are the prerequisites, the knowledge or skills that the students need before entering the course, the course content, what the students are required to study to master the expected learning outcomes, application of the competencies gained, students' continued learning following the course. Curriculum sequencing involves managing the students' learning out in a way that makes it easier for them to achieve the learning outcomes. This may involve moving from the simple to the complex, general information or principles to a more detailed consideration, basic principles to applications in practice. The progression from basic principles to practice, however, does not necessarily represent the optimum learning sequence for the student. If the students fail to see the relevance of courses to their ultimate goals, they may lack motivation and learning may be ineffective. This is one reason for the move to introduce clinical courses and experiences earlier in the curriculum. It should also be noted that the logical ordering of content that is already obvious to a subject specialist is not necessarily the most appropriate way for a student to learn the subject. In some situations, the sequencing of courses may be influenced by logistics. For instance, in clinical rotations, students may undertake clinical specialty attachments in different sequences, not all being optimal. Basic and clinical sciences. An important issue in sequencing relates to the relationship between the basic sciences and the clinical subjects. In the traditional undergraduate curriculum, it was assumed that students should first acquire an understanding of the structure and function of the body before they considered pathology and clinical medicine. Students commence their medical studies with courses relating to the basic medical sciences and, having completed these, progress to clinically based courses. In recent years, this sequence of courses in the curriculum has been questioned. Early clinical experience has been shown to have major advantages. By demonstrating relevance, it motivates students and leads to more effective learning of the basic sciences. It orientates the medical curriculum towards the social context of medicine and eases students' transition to the clinical environment. It also influences students' career choice. There is a strong argument for continuing the study of basic medical sciences into the later years of the course. Peter Garland, former professor of biochemistry at the University of Dundee, proposed that the biochemistry courses be scheduled in the later years of the curriculum rather than the early years. He believed that with this sequence, students would be better equipped to appreciate the importance of the biochemistry they were studying. A spiral curriculum. Relevant to the concept of sequencing is the idea of a spiral curriculum where there is an iterative revisiting of topics, subjects, or themes. More effective learning can result when the learning content is presented in smaller chunks, and these are revisited later rather than when the content is presented in one larger chunk. Learning over time occurs, for example, when the cardiovascular system is considered in phase 1 of the curriculum and revisited again in phases 2 and 3. This helps to ensure that the information and understanding gained is not degraded. Figure 14.1 an example of a spiral curriculum. Adopter attitudes, skills, cognition. Pre-reg year on the job training. Phase 3 years 4 and 5 clinical practice. Phase 2 years 2 and 3 abnormal structure, function and behavior. Phase 1 year 1 normal structure, function and behavior. A spiral curriculum is not simply the repetition of the topic taught. It requires the deepening of understanding, with each successive encounter building on the previous one. The following are the features of a spiral curriculum. Topics are revisited. Students revisit topics, themes, or subjects on a number of occasions during a course. A body system such as the cardiovascular system may be studied in the early years and again at later stages in the curriculum. There are increasing levels of difficulty. The topics visited are addressed in successive levels of difficulty. Each return visit has added learning outcomes and presents fresh learning opportunities to help the student work towards the final learning outcomes. New learning is related to previous learning. New information or skills introduced are related back and linked directly to learning in previous phases of the spiral. For example, a cardiovascular system course in year 3 of a curriculum will build on the understanding of normal structure and function achieved in the cardiovascular course in year 1. In a third loop in the spiral, in the final year, students have the opportunity to study cardiovascular problems in the context of patients they see in their clinical attachments. Competence of students increases. The learner's competence increases with each visit until the final learning outcomes are achieved. Progression. The sequence of courses in the curriculum should enable students to progress effectively towards the exit learning outcomes, with the learning outcomes at each stage being challenging and achievable. This should include the development of the student's identity as a doctor. 4 dimensions can be considered in relation to students' progression through the curriculum. Increased breadth. As they progress through the program, the learners can extend their area of competence to new topics and to different practice contexts. In clinical medicine, for example, they can learn about heart murmurs not previously considered and learn about the situation in children as distinct from adults. Increased difficulty. Students can progress by gaining a greater understanding through addressing a learning outcome in more depth. They may learn more about the pathogenesis of a disease or be able to interpret an atypical example of a cardiac murmur already studied. Increased utility and application to practice. Students can progress from a more theoretical understanding of a subject to its application in medical practice. In the early years, students may practice communication skills with their colleagues or with simulated patients. In the later years, they move on to communicate with patients in a range of clinical settings, at first supervised and later unsupervised. Increased proficiency. Students may demonstrate increased proficiency associated with more efficient and effective performance. This may be exemplified by less time required for a clinical task or the achievement of higher standards with fewer errors. The 4 dimensions are described in Appendix 3. Transition between courses. As students progress through the curriculum, it is important that the transitions between the different phases or courses are as seamless as possible. To facilitate this, a bridging program may be necessary. Transition or bridging courses may take into account students' individual achievements and competencies and ensure that they have the prerequisites necessary for the next step in their training program. Should deficiencies be identified, learning opportunities can be provided to fill the gaps. Transition programs are particularly important at the interface between undergraduate and postgraduate programs when students take up their first medical appointment as trainee doctors. Such a program may include a period of shadowing a junior doctor in post or a review of the practical skills expected of a junior doctor with remediation where necessary. Induction programs can also introduce the new doctor to administrative and procedural arrangements and to other members of the team.